back to your home practice. Today I'd like to dedicate the video to helping your knees. The knees are of course the hinge that helps us in every step, helps us to stand without low back pain, and also allows us to walk far, run far, get through our day better. I've worked with people now for forever, many years, and losing track, and I find that the shoulders and the knees are first to go. These are actually the two trickiest joints in the body, the knees and the shoulders. Hips are tricky too, but these are the trickiest. And what I find is there's a lack of moisture in the ligaments of the knees. Remember, the ligaments join bone to bone. They have less blood supply. Tendons are different. Tendons are the ends of muscle, and they attach to the bone. But they have attachment to muscle. Muscle has a lot of blood supply. So ligaments have a hard time already because they don't have nearly as much oxygen. They're not quite as red with infused with oxygenated red blood. So we want to make sure that we keep the ligaments stretching. So stretching the knees. The way you stretch the knees is by stretching your quads, your thigh muscles. So I'm going to show exercises to stretch the quads as well as movements to keep the knee joint mobile. Diet is also a huge aspect of knee health, and that's way beyond the scope of this video or my practice. But do look into a diet that is not robbing you, so to speak, of, like, that's not drying. Make sure you're drinking enough water, and then just find out anything that's good for increasing your alkaline in your diet, because that will help with keeping the joints moist. And then I just have to tell you one thing funny. One of my clients, Abe, who's a rheumatoid arthritis physician, MD, specializes in rheumatoid arthritis. I asked him one day, we were doing a private exercise session in his home, and I said, Abe, what do we do for crepitus in the knees? And he paused and he said, prayer? So, you know, the terrible big sounds that come into the knees happens because of drying of the ligaments. So we want to make sure the diet is helping. Sleep is a huge factor for knee health. Sounds so funny, but if there's a lack of sleep, that will really affect flexibility and your knees could hurt more. Diet, again, is the biggest factor outside of movement. So let's begin. We'll enjoy some movements and some stretches to help your knees so that you can stay as mobile as you can for the rest of your days.